Good afternoon, folks. Give me a minute to set up for the show, and I'll be right with you, please. Back up just there. Okay, we're discussing a new monitoring system in hospitals' ICUs. Okay, it's used for like TBIs, intracranial surgeries, like head traumas. It's a computerized drainage system. Okay, so we're going to discuss that for today's B. So here we go. A new bedside system called Neuro Sense continuously monitors cerebral spinal fluid for infection markers, glucose, lactate, pH, and flow, giving clinicians near real-time alerts that can detect infections earlier than standard lab testing. What Neuro Sense is? Neuro Sense is a 3D printed smartphone size device that connects to external drainage lines used in neurocranial care and measures glucose, lactate, and pH and flow rate with four integrated sensors and an electrochemical analyzer displaying results at the bedside. How it works: continuous sampling. Fluid from the patient's drain flows past the sensors, so trends are captured almost instantly rather than only once a day. Biomarker panel. Glucose and lactate shifts and pH changes are used as early biochemical signals of infection or cellular stress. Flow monitoring flags drain malfunction or blockage. Evidence and current status. The platform and initial validation are reported in a paper in Science Translational Medicine. Lab comparison and a small ICU patient test showed Neuro Sense performed well against standard laboratory testing, but researchers plan larger clinical studies and to add automated alarms before wider clinical rollout. Give me 1 second, folks. Why this matters. In the U.S., about 25,000 patients with drains for traumatic brain injury, hydrocephalus, or hemorrhage are treated each year. Up to 20% of those cases develop infections that uh, sub, substantially lengthen stays and increase morbidity and mortality. Early detection could therefore reduce complications, shorten hospital stays, and lower costs. Limitations and open questions. Small sample size so far. The device has only been tested in a limited number of patients. Effectiveness, false alarm rates, and clinical impact need confirmation in larger multi-center trials. Regulatory and workflow hurdles. Integration into ICU workflows, alarm thresholds, clinician training, and regulatory approval, e.g., FDA, remain to be addressed before routine use. What it does not replace. Neuro Sense tracks biochemical trends and flow, but does not yet replace microbiology cultures needed for pathogen identification and targeted antibiotic selection. Practical takeaway for clinicians and patients. Clinicians, this technology could become a valuable adjunctant for early warning of infection or drain failure. Watch for larger trial results and published protocols for alarm settings. Patients and families, if you or a loved one requires a drain after brain injury, ask the care team whether real-time monitoring trials are available at your hospital and what monitoring options they use. Bottom line, Neurosensory is a promising near real-time monitoring platform that detects biochemical and flow changes in cerebral spinal fluid at the bedside. Early data are encouraging, but larger clinical trials and regulatory steps are needed before it becomes standard care. Researchers have developed a bedside system called Neuro Sense that continuously monitors cerebrospinal fluid, or CSF, chemistry and flow in real time, offering the possibility of detecting ICU brain infections and drain malfunctions hours to days earlier than today's intermittent lab testing. It's a deceptively small device with an outsized uh, ambulation to give clinicians a live window into biochemical shifts that precede full blown infection. What the study reveals. Neuro Sense is a compact 3D printed module modular module that snaps directly into standard external ven, uh, ventricular drain or EVD lines. Inside its Inside it houses a suite of optometer-based electrical chemical sensors that track glucose and lactate to metabolic markers that shift rapidly when infection or inflammation begins. pH sensor adds another layer of insight. Since CSF acidity often changes early in infection, a flow sensor built using polydopamine and impedance techniques monitors whether the drain is functioning properly or becoming obstructed. In a breach testing, in a bench testing, these sensors showed tight correlation with clinical laboratory measurements. And in a small ICU evaluation, the device successfully mirrored real world CSF trends while the patient cohort was small. The proof of concept is strong. Continuous monitoring can, can capture subtle biochemical drifts that would otherwise be missed between once daily and samples. The clinical stakes are high. Roughly 25,000 EVDs are placed each year in the US, and infection rates can reach 20% in some centers. These infection these infections prolonged ICU stays, increase the risk of neurological decline, and raise mortality. A meaningfully shift a system that flags trouble early could meaningfully shift outcomes. Why this matters now. Continuous insight instead of snapshots. Current practice relies on CSF samples drawn every 24 to 48 hours. NeuroSense fills in the blind spots, revealing trends that unfold minute by minute. Earlier intervention, detecting raising lactate or falling glucose early could prompt clinicians to culture sooner, adjust antibiotics, or investigate drain malfunction before deterioration occurs. Future alarms. The research team plans to integrate automated bedside alerts, turning the device from a passive monitor into an active early warning system. Practical considerations for hospitals and clinicians. Clinical integration. ICU teams will need to consider how continuous biomarker data fits into infection control pathways, sepsis protocols, and antibiotic stewardship. Operational questions. What thresholds trigger alarms? How often do false positives occur? How will data feed into the EMR? Leadership decisions. Hospital administrators must weigh potential reductions in length of stay and complications against the cost of adoption, training, and regulatory clearance. Limitations and open questions. Small patient sample. Early clinical testing involved only a handful of patients, so sensitivity, specificity, and real world false alarm rates remain unknown. Not a replacement for cultures. Neuro Sense detects biochemical changes but cannot identify pathogens. Microbiology remains essential for targeted treatments. Implementation challenges. Alarm fatigue, sterilization protocols, and capability with diverse EVD systems and FDA approval all lie ahead. Neurosense is an exciting step toward real-time infection surveillance in neuroclinical care, an adjunct that could transform how clinicians detect and respond to EVD related infections. The technology is promising, but widespread adoption will depend on larger multi center trials, regulatory review, and careful integration into ICU workflows. Okay, guys, that's your B. I will be back on with C shortly. Give me a bit for that, please. And I will see you guys for C in a bit. For now, Gator Wellness, take care, folks.